Thank you guys for being here today. We are resuming question and answer sessions for part of the Physique Blueprint. We have our very first subject matter expert here, Shannon Ahearn. Am I saying your name right, Shannon?
You are, yes. That's very
Awesome. Well,
impressive. It does.
Shannon is a doctor of physical therapy. She's also a posing coach for her company, which is Posing Prehab. She is a top 3 national level competitor. I saw your pictures recently. You look phenomenal in those pictures. So you
Thank
have a
you.
lot going on for personal experience, professional experience, and really a cool, well-rounded background with the doctor of physical therapy. And then the posing aspect. And I do want to mention too, Shannon is currently on the road with Dancing with the Stars. She has a dance background, so you just bring so many cool different elements to the table. We're really happy to have you here today, Shannon.
Aw, thank you. I'm really happy to be here.
And can you recap kind of how you got here between the dance background, competing, your doctor of physical therapy? Just give us that overview of how your journey has looked so far.
Yeah, I mean, it's kind of a whirlwind, so I like to just say the universe brought me here, to be honest. But I got my doctorate I graduated in 2020. So I graduated through YouTube, technically, just because obviously graduations were canceled that year. So super stoked about that at the time, but everything works out for a reason. I actually didn't even get into PT school the first time, which I'm really thankful for because I just feel like divine timing is such a thing. Once I became a PT, I mean, I'm sure a lot of healthcare providers can relate to this, but when it's your job day in, day out, and even parents too, it's really easy to neglect yourself. And sometimes it's really easy to have a specific reason to take care of yourself other than just, I should take care of myself. So, taking care of other people, I physically noticed that I just was feeling a little weak and I was feeling skinny. I was pretty malnourished. Again, it was COVID, so none of us were thriving. I was depressed. I mean, on top of just the state of the world, it's like you have this big goal that you just finished and you pass the finish line. You're like, well, now what do I do for myself other than just go to work? So
Yeah.
that really skyrocketed me into dipping my toe into bodybuilding. And then for
Mhm.
me, I stayed because I really love the whys that we have for ourselves, not just, not just that you get to look great, feel great on stage. I mean, that part can be fun and glamorous, but I think competing really helps us in a purposeful way with self-improvement. And it's a fun way to do it. So, uh, yeah, and just kind of sprinkle in while I'm just kind of showing all the whys. I did have a background in dance, like you said, I grew up dancing. And when I was posing after my first year, I really think I lucked out during my first year just with my natural flow. But my second year, a lot of underlying impairments just came to the surface. And that was just both in competing and just in my normal life. I had a few different health things going on. And I really noticed it in my posing physically. I mean, I looked labored with my breathing. My front pose didn't look relaxed. I was like, that's funny. You want me to look
Yeah.
cute and pose and also have fun doing it and look super relaxed. And there were actual physiological reasons that were contributing to my posing. So I actually stumbled across this baby I made of posing prehab by accident and um, yeah, and Dancing with the Stars, just because I think you kind of asked how I got into that too, just very quickly.
Yeah.
That was also just kind of a universal moment from my dad falling off a ladder 10 years ago, me meeting certain people and being the persistent one in the room. And then it finally happened for me years later. So,
That's
yeah.
amazing. What a journey and what a lot of oddities in the journey too, which I think just makes it a little bit more special. Like graduating, I actually heard this on your podcast. I should have mentioned that earlier. Shannon is also the host of Doctor in a Bikini, the podcast. So definitely check that out too. We'll make sure we have all the links for all of this in the show notes. But I heard in your podcast that you graduated in your living room and like what a weird time. And then also what a weird time to get into competing. Looking at your pictures, I actually assumed that you had been competing longer. So that's really cool too.
Thank you. I mean, I have been strength training, honestly, most of my life. I think really since some high school age. I don't know, but and I mean, just like not that I am Ashley Coulter at all, but I was a track athlete like her. And so
Cool.
I grew up really with different types of loads on my body, just because I think it feels good to move. So maybe that's why. So thank you for saying it looks like it's been longer than this will be my fourth year. So maybe this is the lucky year for the big old pro card. I'm feeling good.
Yes, I'm excited to hear what your plans are too, but but we'll kind of get into next steps. I want to make sure that we have plenty of time to like pick your brain. And for everybody who's on the call and the audience, just know that we're going to go through some general outline questions that we know Shannon is an expert in, frankly. But if you have additional questions, please let us know. We want to get in and actually make this an interactive Q&A. So please drop your questions in the chat as we're going through everything. So Shannon, I'm going to dive right in to the physical therapy aspect. And I want, if you don't mind, telling us and telling the audience what a physical therapist does specifically here in the US, because we do have an international audience. But as a physical therapist working in the US, what is your scope of work? Who do you
Yes. Oh my gosh, the golden question, because
help?
I swear, which it's okay, but it is just funny. All of us PTs just have this joke of like everyone is like, so you got any stretches for me? Or like, are you gonna massage me? It's like, in all the 8 years we went to school. So but to everyone's defense, it can feel very vague. And I think that's with anything that's not your own profession, it's hard to understand what someone truly does if that's not your reality. So
Totally.
but yeah, so I love that I'm having this moment to kind of address what we do. So with physical therapy, you are meant to be a first line of defense. So that's why we have to get a doctorate, because we do have to rule out through differential diagnosis, is something truly a musculoskeletal problem, or is it disguised that way and there's really an underlying issue. Like a really common one people say is, low back pain. I also need to realize that if I'm dealing with a 50-year-old male smoker, that there's also a high probability it could be a presentation of an aneurysm. So, or even like shoulder pain, right? It can be referred from a different internal organ. So being
Yeah.
able to differentiate the behavior of people's symptoms and what that means, and also being able to understand people's medications, what symptoms could arise from that, or what contraindications. So just first and foremost, we kind of have to have a very broad knowledge of a lot of different things in medicine. But on the treatment side, you'll see a lot of different cool niches, and we all learn pretty similar foundations. So obviously, we do treat things like surgery. People usually come up with that themselves, right? That's a really common image of PT. But whether there's someone postpartum, Diana and I have talked about that a lot. So pelvic floor physical therapy, you see lots of different niches, and really just remove the niche for a second and realize that each person has a body. So I'm going to simplify it here. That way I don't talk too long, but we are treating things from muscle strains to ligament sprains to, yes, actual torn muscles or torn, rotator cuffs. You hear about that all the time.
Hmm.
Lingering pain, acute pain, meaning, hey, this just happened yesterday. Perfect. Thank you for including me. That Rocky. Don't wait until 6 months. But we can also treat things people don't think about, like vertigo, or um,
Yeah.
in my field, right? Obviously, I'm more on the preventative side. So it can be anything from actual physical pain to maybe you have less coordination, or you just have sports specific goals. There's a lot that we can do, and there's a lot of tools that you see online that we use too.
That's amazing. And I love that your approach specifically with what you have morphed your niche into, which is really unique, bringing in the posing element, is very preventive. And just speaking as an outsider, like I have worked closely with physical therapists. My background's in exercise science. There are a lot of people in the PT field, maybe because they're not as recent of graduates, but they do have a more reactive approach, and or maybe it's where their career has taken them, and you've, kind of carved out this different path for yourself where it makes sense to be so holistic and so on the prevention side. So that's just, I just want to point out for everybody that that's really unique. I mean, that's a really, I want to say, advanced, proactive, innovative approach to look at things that way rather than let's find out what you hurt 6 months later. Like you said, we'll start working on it then, when it's just so much groundwork that you have to backtrack on. So I love that you've taken that approach. I love what you've done with opposing prehab. We'll get
Thanks.
into all of that. We want to make sure everybody understood the scope of work that Shannon is able to support with. So
Totally.
speaking of that holistic approach, and I know that there's the mindset part, there's the physical health and everything. Working with the bodybuilding population, what are some of the, if you could kind of come up with an avatar of people that you see as bodybuilders, what does it look like? Where are those deficiencies? What do we need to be looking out for? What are the common injuries that we're maybe walking our way into and we don't know?
Ooh, I feel like there's probably a few different avatars that could build. So I'm thinking first most common would be, let's go with the really motivated bodybuilder that they're like, I want to do whatever it takes. I'm going to really push myself in this off season. And let me preface too, I don't say any of this with judgment. It's just we're humans by nature, and a lot of us can feel really passionate and motivated, which is totally fine. Sometimes that looks like when we're in the gym and we're really like, all right, I'm just trying to overcome my mental setbacks here. I can push the heavier weight, I can do a couple reps, I'm trying to go to failure. And while none of those things are bad at all, it can be really tricky when we have all these other things going on and we're fatigued. Maybe we are, still low on calories, or we have a lot of stress going on. It can be really hard to gauge what your physical limit is. So when I think of that avatar, I think of the person that they're really pushing themselves and they're go, 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 but maybe they don't get off the gas pedal so much. So it's kind of like that
Yeah.
weekend warrior where they might have a lot of underlying, let's just say, injuries. Because I know also people's perception of injury is something is wrong, but you don't have to wait for it to get to that point. It can be like, ooh, I noticed that I kind of can't go as heavy with this side, or ooh, I noticed this side is always tight. This is always popping. This feels really stiff and I have to work on it. Like those can be little communications that your body's trying to say, maybe we should get a little bit of help sooner rather than later. So I'm gonna say the motivated avatar is one that I see a lot, just because oftentimes competitors, we are competitive and we have a lot going on. So it can be really tricky and hard to ask for help or to find time for the help.
Yeah, that A-type personality, right? And I like that you call it motivating because I feel like I always say A-type, but I maybe motivated is probably a better way to summarize it because that is a lot of what we see, that grind, 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 and don't back off the gas pedal. I really like how you said that. So what for those types, like, is it overuse injuries that you end up seeing cropping up, or is it more acute things?
Good question. Yeah. So I think it can be a few different things. Sometimes it can be overuse, 100%. And sometimes it's something as, for lack of better words, obvious as maybe they're not warming up or cooling down enough. Sometimes, to just be frank, sometimes someone thinks that they have great mechanics, whether they saw it on YouTube or Instagram, or maybe their coach, because coaches are humans too, right? We all learn and we have to make corrections and modifications. Sometimes someone might think that they're doing the right thing or that this is what they're supposed to feel, and it's actually not. And they're like, oh,
Yeah.
no idea. And sometimes too, in addition to overuse, sometimes it's that lack of knowledge and coordination. So they're just kind of pushing it. Like I know I saw in the questions that we have before here, a lot of people ask me about vacuums, right? Or bracing the
Yeah.
core, or people get really passionate about like the belt, right? So there's a lot of underlying impairments when it comes to core, which is our foundation of our whole body. Like if you're a giant tree, these are our tree branches, your trunk has to be so stable. So I think it can be overuse. It can be maybe we can optimize how you're moving a little bit. It just kind of depends on the person.
Yeah, so person dependent. And I appreciate Diana, our community manager, shared that she started chatting with Shannon because she had lower back tightness and her left glute wasn't firing during workouts. And I will say that Diana is one of the most self-aware people I know. So to your point earlier about sometimes people think they're doing it really well, or they maybe wouldn't pick up on something like that until it becomes like pain or like an actual imbalance that your coach calls out for visually imbalanced in the muscle because her glute wasn't firing. So it's really can be so many different things that you're able to help with.
Yeah, and honestly, again, back to the human point, we
Hmm.
all, PTs included, have something that we have to put effort into making sure it runs smoothly, just like everything else. So for anyone feeling ashamed, like admitting that, something is hard or something feels uneven, because I think some people might feel reluctant or embarrassed to say, I'm not sure about this because they feel like they're saying, I don't know what I'm doing. That's not the case. If anything, it's the opposite. They're like, hey, I really care about how my body's functioning. Can you just see if you see anything and let me know? I'd love the feedback. I think that's totally fair too.
Yeah, absolutely. And guys, if you do have questions at this time about, hey, is this normal? Is this something I should be feeling? Remember, you can drop them in the chat. We'll be keeping an eye on that so we can ask Shannon in real time. But let's talk about just kind of general things for preventing those injuries. Um, do you mind going through some best practices that you would tell any athlete to do just in terms of my head goes to like just a basic warm up, getting some mobility in, being a little bit more tuned into those weird feelings. Do you mind going through some of those best practices for self-awareness and just to make sure we're staying injury free?
Yeah, totally. I think the warm up can look so fluid for people, but obviously, yes, including some movements to target the muscle groups you're training that day. I also personally, no matter what, because of what I said about us being like a tree earlier, I like to incorporate different variations of core and breathing tasks and mobility. Because I think, I don't want to misspeak, but I think a lot of people from what they share with me, they show me their warm up and it is so in and out quick. Some people are
Uh-huh.
really good and they have a whole routine, and I think others might get threatened because they're like, I don't have time. I've got kids, I've got work. I'm just trying to get and do what I need to do. Maybe if I'm being, truthful, I do this one movement. That's it. Totally fine.
Hmm.
If you do one movement, make it as intentional and pace yourself and incorporate things like your core breathing where you can. And it shouldn't feel forceful. I think too, when I say core, some people they think like you're really bracing or it has to be this forceful vacuum. It can look different depending on what someone feels that day. So I think that's the most important is whatever fits into your schedule, you'll be most successful. Don't worry about a specific perfect list because for each person it's going to be so different. But
Do you
yeah,
have a favorite go-to move?
oh, I would say for me, for a favorite warm up, I mean, I honestly just love, I even in my suitcase on the tour bus, I have a band with me for my knees and I have like my little ankle strap, but I love a
Hmm.
good banded warm up. So I love
Yeah.
any bridging variations. I love incorporating different holds or pauses, or maybe I change to a single leg while I have the banded resistance on. And sometimes certain things just aren't feeling super well oiled. I'm sleeping on a tour bus right now, so my body does not feel great. So what I can do today versus what I was able to do 4 months ago, it definitely looks different. So
Yeah.
bridges are just simple, they're easy to do. You can change them up, you can add a little clamshell with it. I mean, and I love doing any sort of planking activity with breathing too.
That's fantastic. And that's really good for people to know, kind of just have a basic place to get started so you're not going in cold. I've been obsessed with dowel supported hip hinges recently. So
Yeah.
taking a dowel and actually bracing it, my hip hinge can never be on point enough. It's like a work in progress all the time to get better engagement. So you kind of go through a deadlift motion with that, and then you have the dowel for a little bit of extra guidance. And I love that. I mean, it's one of those things, it's the activation, it's the actual checking the box for the warm up, but then it's really helping me focus. I do it for lower body day.
Mhm.
So it makes a huge difference. I think it can really make a big difference in our lifts as well. So
Total.
whenever people are getting injured, one of the big things that we've seen, and actually I pulled this statement from an older post in the group, lower back injuries are no joke. Tips for stretches so I can at least keep my cardio going while healing. Um, there's for sure the stretches, depending on what's going on, I'm sure. But what about just managing the mental side of this? Because a lot of what I see come up is just people are the motivated personality, like you say, and then suddenly they are sidelines and they can't train, they can't do the things they want to do. So do you have any tips for the mental side?
Yeah, so many things. And I think personally, I love when I get a client that one feels comfortable enough to share with me, but two, when they do have some of that component, not because I love they're going through that, but because I love helping people because I do understand pain is a real emotional experience for people. Um,
Yeah.
and it can be really freaky. And I think especially when you hear back pain, and this is from personal experience actually, before PT school, I used to have constant and some fear associated back pain. So I can really empathize with just kind of being a little freaked out. And not everyone is like this, but wanting to know what's going on. And I think a little bit of education goes a long way because, at least for me, my severity of pain changed so much when someone sat down with me and explained what was probably happening, my body style, things that I should be mindful of. It really helped a lot. And I think that took the fear component out of it. So I think just communicating for one really does help with the mental aspect, communicating to the right people. I love our
Yeah.
I love our platform, but usually I tell people not to go on the internet in general
Yes.
if they're trying to seek advice, right? Totally understandable though, we're a very niche group, so just getting some help or some emotional support is totally fine. Um, but I think also another random tip, um, just kind of a little bit closer to their question too. This isn't always the case for people, but the one thing I like to kind of pry for is when you do have back pain, try and associate any sort of patterns. And what I mean by that, I usually
Yeah.
ask people, do you notice when you're standing versus when you're sitting, it behaving differently? And the reason why I ask that is when someone is sitting and supported, it can tell me a few different things. Sitting, you're flexed in the spine, so it's a different position than standing. So that helps me to rule out if it's more flexion-based pain or extension-based pain, because that gives us
Yep.
clues on what movements are helpful. But also when we're sitting, we're supported. So maybe there's not a directional preference component in their spine, but maybe it is, wow, it has some external support so your body can actually go, oh, we're we're supported, so we're not in pain. So pay attention to those things just for the sake of their mental, not to try and self-treat, but to give themselves reassurance that, oh, there's some correlation here, which means that this is something I can work on and I can improve. So it's not something that's forever. Because I think that's something a lot of people get nervous about is this my life now? Am I done? Am I too old to be competing?
Yeah.
So they're not alone in those thoughts, but most of the time, a lot of those really scary thoughts are just that. They're just scary thoughts, but they do need to talk to somebody qualified to kind of problem solve and be as preventative as they can.
Yeah, well, that's so smart though. And I think trending anything that's going on with your body is going to help when you're talking to the right person, because that is a very important caveat.
Mhm.
It's going to help you advocate for yourself. You know, you've got just so much more data based on those movement patterns that may have caused, triggered the pain or whatever's going on in your body. But having that trending to actually communicate better and advocate for yourself is so important. I want to circle back to a phrase that you just used a moment ago, fear associated back pain. Can you elaborate on that phrase?
Absolutely. Yeah. And I'm gonna speak about myself so that way I don't risk, offending anybody.
Yeah.
So, because I always emphasize with people, everything they're experiencing is very real, and I always empathize with that. Because unfortunately, I've seen in clinics I've worked in, some people don't get that experience, and I hate that. We all
Yeah.
deserve to feel heard and to feel supported. So, my personal experience, like I said, I grew up as a dancer. I also did cheer, gymnastics, track. And I think when we're younger and in general, our bodies are just so smart that we can muscle through a lot. That's why you hear people say, like there was no problem before, and then I turned this age and then everything fell apart. No, it's just your body was so smart and resourceful for so long that finally it was like, we can't keep going like this, just compensating that. We're going to have to communicate to her, and we're just going to do it through a little bit of very inconvenient pain. Um, and I think for me, as a young athlete, let's see, this was college. So this was actually kind of like trigger warning a little bit, but just to set the stage for maybe some things that people might be going through. The year that my back pain was very severe, I don't think was an accident at all because I didn't have an injury. I just woke up and it's like all of a sudden I just had all this constant pain. But looking retrospectively, this was also the first year I didn't get into PT school. So I felt like a
Oh,
huge
wow.
I lost my grandma, so that was my first big experience with death. And 2 days later, my cousin was murdered. So I had a whole lot of not socio, oh my gosh, I had a whole lot of different like personal factors going on. And this was my first adult job with no windows, mind you. So I was working
Ugh.
inside from 7 a.m. to 7 p.m. And this is after you graduate college and you have this very fulfilled social life. You have this big goal you're striving towards. And then now I go to work, it's dark. I come home, it's dark. I don't see my friends every day. I'm dealing with whatever grief box I have going on over here. I'm not in a sport. I don't have any sense of community. It's just work and that's it. And am I going to get into PT school? And I had this constant pain. And I don't think I actually realized that I was dealing with anything. So
Yeah.
that was my first experience of like this constant unprompted pain. And I thought it was because I went top golf once and I was, which it very could have been my top golf swing, but I think honestly, it was just my body was like, all right, one more thing we're going to communicate to her. And
Yeah.
all these underlying impairments that were always there. Like I'm more flexible in nature. I'm less stable in nature. So now the center of my being literally said, we can't take it anymore. So we're just going to constantly ache. So I really
Mm.
had to learn not only the emotional side of pain from an earlier age, but also how to be proactive when something feels like everything hurts and there's no reason, and to try to not feel emotional about that. It can be a lot. So I think many of us have those experiences at some point, whether, varying degrees, because we all have very complex lives. But I don't think it's far-fetched to think that a lot of the time stress plays such a huge role in our pain experience. And that's why I'm so passionate about, people explaining everything they're going through. Because I'll try and
Yes.
ask somebody like, all right, so I know we talked about this. Is there anything else in your life going on that like you would like to share? And it's okay if you don't, but I really want to understand everything important going on to you in life right now, so that way I don't miss anything. And 9 times out of 10, usually they tell me something, you know.
Yeah. And good for you for digging. Thank you so much for sharing that because it means so much coming from someone with your background. And I think just to hear it laid out like that, then maybe it didn't all happen on the same day, but those things compound, and you have a really good analogy there of your body just being getting to that tipping point of just tick, it's just too much. And it could even be that you're at golf and your body's like, you gotta slow down, because
Yeah,
it's like, and that wasn't really the stress and all the accumulation can be such a big deal. So it matters so much to hear that from somebody with your background because I do think sometimes we get into, is psychosomatic the right word, where it's like your mental is impacting your physical. So psychosomatic symptoms. And it sounds woo and it gets discredited. But it's like those things manifest in physical ways all the time. And we can just kind of spin our wheels for years with surgeries, medications. I mean, people go down really far rabbit holes trying to fix things that were nothing to do, I don't want to say nothing to do with their body, but were manifestations in their body.
yeah. And then on top of that, you're just adding more to this story of nothing's going to help. This is never going to go away. And
Totally.
seem like it, that totally digs the grave, like dig not the grave, the hole more for the
Mm.
person. And it just, I think sometimes, like you said, it really does have to do with finding the right person because 100% any profession out there, there's going to be people you really jive with and people that you're like, I did not like that person at all. They did not hear me one bit. And unfortunately, some people are like, I did PT, it didn't work for me. And it's like, I would love to see like how that experience went and maybe why it didn't work. And I think that's worth considering with a lot of different um experiences. I don't know, better word, but
I totally agree though. Yeah, well, I'm glad that we covered that because that wasn't really something I was thinking about talking today, but I'm just really glad that you take that approach for looking at things so holistically, and I hope that's a takeaway that everybody can take for just general injuries, general pain, discomfort. Guys, feel free to drop your questions in the chat if you have any questions about general injuries. But Shannon, if it's okay with you, I'd like to take us on to the topic of pelvic floor health. Woohoo! I know that I see this come up on the group a good bit. So I was tagging you in a million things before we hopped on today, but I wanted to make sure that we specifically address this because we are a group of women, and pelvic floor health is so important. And I from my perspective, it's becoming more a common part of the dialogue, a common part of like what is included in wellness, which is great to see. So if you don't mind, give us an explanation of the pelvic floor, its function, its common dysfunctions, just the high level overview so we can all get on the same page with pelvic floor.
yeah, okay. I'm going to be as succinct as I can about a very complex topic. Uh,
Yes.
so in general, you see it everywhere, and I think just because it's the easiest explanation to think of, but replace my tree trunk analogy. And when you think of our core, a lot of people think of their six pack, they think of their abs. For me, I beg to differ. I like to think of our core just because of the muscle attachments. Honestly, from like literally here, and for audio listeners, I'm gesturing to like my head and neck to my knees because a lot of those muscles do overlap and share attachments to that central support system. So I think our core in general is a lot more in depth than we give it credit for. And with our pelvic floor, it just seems like this ominous thing, and people just think of like if you ever seen Bridesmaids where they say like the undercarriage, it's not just
Yeah.
not- more than just the undercarriage, but it's really a lot of people think of this analogy called the soda can. So when you think of our
Yeah.
trunk, it's this encasement, if you will, and inside of this encasement is a bunch of important things like our organs that do sit just above our pelvic floor. You also think about our diaphragm too. That's a big part that it gets left out, but I think people are talking about it more. So they all are a part of this well-oiled machine. And I don't know where we got here, but somehow I think with pelvic floor, people just immediately think Kegels. And
Totally.
it is not even the answer 50% of the time, I would say. It is so dependent on each person and their assessment. So when you think of the pelvic floor and the function, really, I think it does have to do a lot with our centered support system, like I mentioned earlier, because it is literally the center of our universe here. Uh, and when you think of different loads, it is meant to support us. So when you think of loads like squats or jumping movements, or even, pressure on our pelvic floor, like if you're pregnant. So lots of different scenarios that our pelvic floor, which is just the bottom of that soda can, has to
Hmm.
support. So I think it becomes this big thing that again, I think people are more comfortable talking about, but maybe not everybody considers until it's a problem. So just a quick debunk, when you hear, I have a small bladder, myth. When you hear,
Oh,
oh, when I get older, like that's just how it is. I'm just gonna pee a lot because I'm older. Also a myth. Age does not mean that you have to be incontinent. Um, and I think too, when you hear people that have this relationship with the bathroom or with jumping movements or with pain with sex too, a lot of these people just accept it for being what it is. And it does not have to be that way. It doesn't have to stay that way. It's just a matter of trying to find the right resource, and that can be really tricky sometimes.
it can be super, super tricky. And that's actually something I meant to go into earlier. At least in the US, the process of actually finding that right resource and getting into the right hands can be really hard. And correct me if I'm wrong on any of this, 'cause I haven't been in PT for a while, but you're going to typically go to your primary provider, get a referral into a PT. If you need a specialist that takes you down like a pelvic floor route, it may be another session to go in and find that. So correct me if I'm off base on any of it, but I do think that's what's really special about where you're stepping into this space and helping people virtually. And it's just the accessibility is everything and not having to go through those channels that frankly people just don't want to go through sometimes.
Yeah. Yeah. And I think another, while we're talking about like barriers and potential misconceptions too, at least in the US, I'm pretty darn certain every state, maybe there might be a lagged one or two. I haven't checked recently, but most states are a direct access state, which means in theory, you could go up to a pelvic floor physical therapist office and say, I want to make an appointment versus having to go to your doctor. But the tricky part is, not every single insurance plan is on board. So that's the tough part, is it's not that it's
Yeah.
law with the state or with PT. Some insurance companies do require a script. So the easy way to find out is you just look at the number on the back of your insurance card, call it, and just ask straightforward, say, do I need to go see another doctor before I see my PT, or can I just go there myself? And it's
Yes.
independent.
Thank you for sharing that. And I feel like I'm pulling us off topic, but the access really does matter. So I want to address a question that came up in the chat. Is leaking during heavy lifts related to pelvic floor?
It definitely can be, yeah. So I think a couple ways that you can experiment, or yeah, we'll say experiment, because let's just say if this person, if the leakage is because the pelvic floor is having a hard time supporting and being for lack of better words, relaxing when it needs to, supporting when it needs to. So
Hmm.
one thing you could do to experiment is lighten the load, and don't take that too much to heart. I know sometimes we're like, oh, I really want to challenge myself. If you have to decrease the weight, then maybe increase the repetitions or change how deep you're going too. Because sometimes some people might have better control of their pelvic floor within a smaller range. So maybe it's the range that's the issue. Because I will say, just like the squatty potty, the farther down you go, the more those muscles are relaxed. And if while they're
Hmm.
relaxed and vulnerable, if they're having a hard time supporting, that's where you might get that accidental leakage or that extra tensing when it's not supposed to, because it feels unsupported at that awkward angle. So
Yeah.
could be going through a smaller range or decreasing the weight. And then if you notice that you don't have the same symptoms with the smaller weight or the smaller range, stay there for a good chunk of time, like at least a couple weeks, and then gradually increase, because that can give you some good insight that maybe if you see improvements, that, all right, it is a control thing. I just need to work on, you know, feeling stable when I need to and relax when I need to.
Yeah, that's fantastic information. Thank you so much for that question. And that is really great to have that troubleshooting in place. So I love that feedback around that. And that is a pretty common question. I mean, that, and I would say jumping, like you mentioned earlier, I hear that one a lot, or like sneezing as well. So what would you say for those that maybe don't have, I mean, you don't really have a lot of control over like how you sneeze or if you jump or something like that, that's either kind of an on or off thing. Would you say to kind of trend that, or what would your advice be for someone who does have those symptoms?
Yeah, and all these people, obviously, I would tell them, consult either if they can message me directly with any questions, or if they need to go see somebody, just to see somebody. But in the meantime, to your point, where sometimes you're not able to see someone right away. I don't want to leave people with nothing, especially if these things can help them to naturally improve their problem, or the problem. So I would say
Hmm.
for people that are jumping, you want to think about how can I decrease the intensity of that. So, um, honestly, really the jumping is just the unpredictable, unsupported quality. So maybe someone is training those unpredictable, unsupported conditions, whether that's, squatting on a Bosu ball, flat or round side, because it's kind of uneasy. So they have to stabilize without excessively tensing anywhere, and trying to keep their breathing smooth and relaxed and just controlling the movement. It can be using some TRX straps, and you're doing some alternating reverse lunges, because that is also an unpredictable movement with your lower half that
Hmm.
it has to control. Step ups, things like that. A lot of times, some people with this presentation, they might have pelvic pain. So if that's the case, and if they have shearing pain with step ups, then, I would tell them to try something else. But um, just trying to create different movements. That way they don't fall into this whole, I can't work out, but finding something that they are able to do. That way there's that positive reinforcement, and then building up to. So whether that's, a very small, quiet jump in place, low jumps.
Yes.
Some people, they're like, I feel kind of dumb. I'm like, don't feel dumb. You are literally meeting your body where it's at. and you are
Yeah.
slowly progressing, because back to that emotional component and stress, those absolutely have a role in inflammation and tightening and tensing. So when we feel discouraged or angry at ourselves, it doesn't help anything because it's just going to create this stress behavior. Same with sex. People get a little, they might feel a little nervous because they remember, like, ooh, I kind of tighten up. Try not to feel frustrated, try not to feel embarrassed. You just kind of have to meet your body halfway.
Yeah, and I think that is such a great response. And it's the opposite of, I mean, meeting it halfway may seem small. It is still the opposite of saying, I'm X years old or I have X many kids. This is just my life now. And letting that problem persist for another 50 years and like holding yourself back. So I think that's still, it's such a great mentality to have. I'm going to pull on a couple other questions that have come in. I have a question about pelvic floor. This muscle is part of your lower abs, and I found out that if you train it, it will make your lower belly abs flatter. For example, when you breathe out, you can squeeze it. Do any of you train pelvic floor specifically, or just automatically breathing out during your workouts? And I think the big thing that stands out to me is the lower belly abs flatter part. That was an interesting angle on this. Do you mind addressing that?
Yeah, so I will say respectfully, the wording, it's either like telephone, or like, I remember I was told this one thing, and then they're communicating how they kind of understood it. It's like if you were telling me to communicate something with engineering or plumbing, I'm probably gonna like, so I don't know how it was delivered. I don't know if I love how the fact was worded about like the training. I can't remember exactly the wording. But to your point of the lower tummy flattening. So I'm trying to think of how to word it. I don't think it's a direct cause effect relationship. What I do think is all of the components that you typically see associated with someone that has any sort of pelvic floor dysfunction, because our bodies are more dynamic than just one thing being wrong, which is the super fun but also really complicated part. um, that a lot of times someone with that presentation, where maybe it's a posture thing, maybe it's an inflammation thing, maybe it is a lack of coordination. So therefore the lack of coordination in their core and their pelvic floor creates this, um, this look that people don't love. 100%. You can see improvements based on addressing the right impairments. It's just a matter of finding
Yeah.
the thing. And typically it's not what it seems like. So I think people hear pelvic floor strengthening and they're like, I'm buying the weights off Amazon and I'm wearing those, or I'm using, using Kegels to my advantage. No, but, and one more, because I don't want to get too sciencey. Say if somebody has pelvic floor dysfunction where things are too tight. One, they probably don't want to do Kegels. There might be a combination where it's tight because it's weak, and then that might be the rare event where someone, once they've learned how to relax, then they work how to strengthen the muscles. Um,
Mhm.
with that being said, too, a lot of times pelvic floor is something as non-sexy as incorporating breathing or finding those relationships where your body is supported and then gradually increasing your strength and decreasing the amount of external support. Those things, because of that soda can analogy and that core,
Yeah.
I told you, it's often so much more than just something specifically at the pelvic floor.
Yeah, there's so much more going on. And I appreciate you addressing that in such a comprehensive and very respectful way. Um, if I'm being honest, I think it's one of those things that I worry when people, it's you lose the point of pelvic floor work or core conditioning or stability, like the word that you come back to that you were saying that like stability. If you're thinking that you're gonna flatten your belly a little bit for this, I think that was the part that I got hung up on. So I appreciate you answering it so politely and and
Yeah.
holistically.
Yeah.
Another thing that came in, oh, go ahead.
Oh no, no, I was agreeing. I was saying, yeah, I mean, don't get me wrong, people might notice like improvements and changes, but maybe don't think about it as like, if I do this, then this for sure will happen. It's probably a process of things.
I don't know that anyone's ever Kegeled their way to a smaller waist.
Hey,
That's
you never know.
possibly where they so the another one that came in was stage 2 pelvic floor prolapse. She said I can continue to go to the gym just to lift light and make sure I am engaging my core, but she's nervous to make things worse, and has some limitations.
Okay, yeah. So wait, really
So she
quick.
was working with, go ahead.
No, you're good. Go for it.
She was working with a PT and was told that she could go back to the gym but start lifting light. So I guess this is a little bit of putting someone's mind at ease. And if you don't mind going into the background of what stage two prolapse would look like to keep us all on the same page for that,
Mhm.
which would explain why they may have some concerns around this.
Totally. And I think honestly, if that person were to contact me, I think that's the perfect person for me to help with because I think in the PT world, unfortunately, or even just the medical field, because there are um, such fun components with insurance that sometimes, even when we do want to keep working with patients, sometimes for whatever reason, that provider can't medically justify it, or that patient can't afford it, or other reasons, right? So here comes this after part though, where, all right, strength train light. What does that mean? What do you mean?
Yeah.
What's really safe for me to do? What can I try? I haven't tried this in forever. Maybe my PT and I never got to this. So I'm the perfect person to help with that because there are a lot of considerations to make with exercise progression and regression that social media deems as like this glamorous thing, but there should be a lot of thought behind what a specific program for somebody, especially if they have some sort of background in this. So really quick, the stages of pelvic organ prolapse, it can go from 0 to 4. So to remain as factual as possible, I'm just going to read it in like medical terms. So stage 0 is pretty simple, just no prolapse at all. Stage 1, so it's the most distal part of the prolapse, and that's more than 1 centimeter above the hymen. So the most distal meaning like the furthest away. And then
Hmm.
stage 2, the most distal part of the prolapse is between 1 centimeter above and 1 centimeter below the hymen. And then stage 3, obviously, it gets more and more progressive. Um, the most distal part of the prolapse is more than 1 centimeter below the hymen, but less than 2 centimeters shorter. And these are um, objective, measurable. That's why it's talking about
Yeah.
here. Stage 4 is just the complete eversion, so like complete total prolapse. So obviously you have to go to a provider where they give you something called the POPQ, which is just a questionnaire, and they do their own medical analysis of what stage they would diagnose you at. Um, and it's not uncommon, honestly, especially when you think of if someone has been battling pelvic floor dysfunction for years, maybe someone had like a very significant load with their pregnancy. I mean, everyone is just so different. So, and it is preventative. I mean, these things, all these principles that they're hearing, that everyone's hearing, the better support system you have, the least likely or the least severe it's going to happen. But for that person in specifically, she said she's doing light activity. She mentioned anything that she is doing right now?
I don't remember if she didn't say specifically,
Okay. But her
but I
main
think,
question,
Yeah,
sorry.
I think her main question was just kind of, like you said, kind of crowdsourcing, like people come to the group to do for that emotional support, because this was instructed by a PT to go in and go light. But you made a good point earlier about, what is light? I think that's really important. It is light 135 pounds on a back squat is light, no weight on a back squat, so I think that those specifics really matter.
My advice, for one, would be to come chat with me, but two, don't focus so much on the progression of weight. Focus more on the progression of internal stability, and that's going to be the best thing for her. And what I mean by that is things that you can change. So let's say if we're talking about a squat, there's the predictable normal body weight squat, or both feet are on the floor and they're
Hmm.
going through a small range. That's going to be the easiest, most stable. And then you start to change things like going deeper, or maybe now your feet are a little bit more narrow. You're creating less opportunities for stability. So your body has to internally calculate a bit more. Um,
Hmm.
maybe you go from that narrow base squat, and maybe you're doing like holds at the bottom. Maybe you're holding a little weight with yourself. Maybe you have a band at your knees. Maybe you're doing a slight split squat because maybe an actual lunge feels too vulnerable right now, but doing a controlled
Yeah.
stationary split squat as opposed to lunge walking. There's different progressions and modifications that can be made. And that's where the PT component comes in, is I understand physiologically what your body has to account for during these movements. That online, it's just like do some squats, do some lunges, do some jump squats, do some twists, do some, and maybe you can't do that variation yet, but we can figure out a version that you can do for now.
Yes, that is such great information. I really appreciate you sharing it with that detail because it makes it so much more actionable for people. Like here are some actual like ideas that you can run with because this does come up a lot and I think people probably aren't talking about it even as much as they're dealing with it. So I appreciate you going into that. I know we're getting kind of close to the hour and I want to make sure that we dive into all things posing prehab. So do you mind telling us all about posing prehab and we'll start there?
Yeah, well, I think we've laid the groundwork really well for who I am and how I can help. So that actually helps me with explaining posing prehab. The reason why I phrased it as posing prehab is I want to be there for people, even if they already have a posing coach. Because some people, they might see my posing, they see my Instagram, maybe they see me on stage, and they're like, I really want to work with you because of your dance background and because of your cues as a PT, which I agree.
Yeah.
I love helping with posing. I do. Selfishly, I'm like, if everyone did come to me for posing, great. I love it because I think sometimes it's just a cueing issue. Sometimes for people, it is a mobility issue. Sometimes it's a muscle firing thing. So it just depends. But I don't want to close myself off to only, oh, thank you, Diana. She said Shannon. But I don't want to close myself off if someone has a really great relationship and they're nervous about offending their posing coach. I want to be able to help wherever possible. So even if that's me collaborating with the athlete and their posing coach on, let's figure out together, what do we see, or what's a barrier that you both have been working on, you can't quite figure it out, and then I can help and say,
Yeah.
let's have this athlete try these things on a daily basis, or let's give them these specific posing exercises, because I do create certain exercises that translate well into posing. Because, and some people aren't gonna like this comment.
Uh-oh.
I understand the value of vacuums. You get told that we don't necessarily, at least for the bikini division, we don't necessarily vacuum on stage, right? So while I see the purpose, because there is a purpose with practicing the vacuums for control, I think we want to make sure that you are also, in addition, practicing things that are similar to posing. And, that can be as simple as, holding your poses. Yes, I think a lot of us do that, but we can go a step higher. We can do specific activities to really translate into it. And that's where I come in. So whether that's helping with the posing coach and the athlete and collaborating, or bringing someone from ground zero where they've never stepped on stage before, I love all of that.
Yeah. So cool. And are there any divisions that you primarily help or any federations that you primarily help? I'm guessing with your background, like you said, you can be complimentary or you can take on the whole task of being the posing coach, but do you have any limitations for divisions that you work with?
I'm so glad you asked that. So I agree. Because my job literally is to treat bodies, um,
Yeah.
I can really put my mind to a lot. I would say maybe if I'm trying to work from ground zero, I would just have to do research to help with, some of the men's categories. Um, but I think, and I also have resources too, if someone wanted to work more on like a figure routine. Do I feel comfortable? Yes, but I've reluctantly advertised it in that way. I can help prehab wise with anybody, but I can also figure out a routine, because really it's just movement, it's just dance, it's just
Dance part is
understanding
so cool.
criteria. Yeah. So I mean, do I feel
Yeah.
comfortable? Yes. Do I treat everybody? Yes. So I would say, and I have had experience with multiple divisions, and I have worked with fit model, bikini, and wellness. I just have yet to have a
Mhm.
figure athlete approach me for help, but once they do, I will dive in.
That is so cool. And I appreciate you going into that. And I just can't emphasize enough for everybody who's listening, and especially if you're newer. I mean, this comes up all the time, how dancers are the best posers. Because they just have so much flow, so much grace, but they're also able to spot things that us normal humans like can't spot. So there is such an element of, even if you're, and I think it's great to work with different posing coaches. I actually think I may have my own bias on this, but I don't think that you specifically should or need to have loyalty to a posing coach, because the different set of eyes can really help. The different cues can really help. I think posing coaches are not like a prep coach where they need to know your body. They need to have like a bit more consistency with you. I think that hopping around and getting different perspectives is really important. So I
Very
love that
fair.
you've taken that approach to where you can be ancillary or take it on completely. So I think that's fantastic. Let's make sure I get through some of these questions. How about range of motion and mobility when it comes to posing? Can you go into that a little bit just for some best practices to help athletes?
Yeah. Oh man. Like when you say range of motion and best practices, do you mean um like common impairments I see or like little things that I've had people do? How would you like me to go about that route?
So specifically, I'm thinking of myself,
Oh yeah, yeah,
and
yeah.
I'm
Lay it
being
on me.
But I know for me, like my front pose was super hard, and share a personal experience. I actually hurt my back front pose doing my front pose, just like a little strain or something, and then had to deal with that for the rest of the season. Like hurt it before I even got I think I was like one show in and had three more, and was hurt for the whole season. And that just comes from being in a posing session where they're like twist, 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 and I just don't have that much mobility to twist into that front pose in a way that is as aesthetic as possible. So that would be a limitation to my range of motion if we don't mind using that to explore that question a little bit more.
Yeah. So when someone comes to me, because that specific uh story gets told to me a lot, actually. I would say usually I look to see what I see because sometimes I can see something on their body that I can see this part is forcing or this part looks stiff. So sometimes I'll start there and I'll investigate and give something to address that. I might also test to, like, say, when you think of your front pose, when you're laying down and you do the same, like upper trunk rotation, is the same pain reproduced? And
Yeah.
if yes, then that gives me some good feedback on, okay, maybe let's look at some joint mobility. If it's primarily just in standing, that's interesting because when you're standing, it's harder, you're less supported, like you are laying down. So that gives me some good insight on how muscles are performing and actual tension that might be present. So I might actually give you some specific activities that help improve stability while relaxing, working first through a comfortable range and then after using that as a warm up, then working on some more end range mobility, maybe another core task, and then retest and see if the front pose feels better.
Cool. That is amazing. And guys, just to share, like in case the value of that isn't clearly communicated by what Shannon just said, for me, this was an injury that lasted for probably like 6 months. And then since I was already deep in prep, I didn't feel chose not to back off, and I didn't want to have to, lose all the weight again and do all the things. So I pushed through it, and to like hold myself together, spent a ton of money just with like band-aid fixes like chiro and massage and Graston and things like that. So just trying to do what I could to hold my body together to get through that season. And it was I still remember how much that aspect of it was tough. So getting
Yeah.
out ahead of it whenever you realize that you have those limitations by working with somebody like Shannon, especially in the off season when you're not super depleted, can be so advantageous and just put you out so much further ahead.
Yeah, I love that you mentioned off season too, because I think some people in their off season, they might think like, oh, I'm not stage ready, so I'm not ready to do this yet. Or I want to wait until I'm closer to a show. Don't necessarily do that. I mean, if you're strictly wanting posing from me, do whatever you need. Even then, I think you should still be working on endurance wise more than 6 weeks from the show, like further from that.
Totally.
But I think, like I mentioned towards the beginning of this podcast, we all have things that can be stronger, be more mobile. So I feel like there's no specific time that someone has to work with me. Um, literally the time is now.
Yeah. Do you have any recommendations for when, because we get that question a lot, when should I hire a posing coach? And if, let's just say that a lot of people who are doing a first time competition may sign up to do a 20-week prep. That seems to be pretty common as well. Keeping that in mind, when does the posing coach ideally come into play?
Yeah, I love that you asked this because even when I started competing, I was told 6 weeks. Now, granted, it was fine.
Really?
Yeah. I was told to
So
watch
short.
I know. I was told to watch some videos and stuff, but like for me, I am such a tactile learner and I like personal ties and experience and, one-on-one sessions. So watching YouTube was just more confusing. I was like, I don't know what is going on. There's resources. What do you mean there's different divisions? Like when I started, like nothing and everything is on the internet and nothing makes sense. So, I
Yeah.
with a posing coach 6 weeks before, and maybe it was like 8, but I know it wasn't a long time beforehand. I think the earlier the better, especially from the standpoint of stress, because I think
Uh,
so, could someone pull it off? Probably. I literally brought somebody to stage in 4 weeks, 0 to nothing, and they won.
nice.
They won their novice class. I
That's
was like,
amazing.
whoa, whoa. But I was like, when's your show? 4 weeks. I was like, we got this. We got this.
Gosh, 6 weeks though,
Uh,
that's just wild to me because at that point people have prep goggles anyways. You're so stressed. Like 6 weeks is when people really start to get in their heads. Like you're flat, there's just all kinds of stuff going on. And then you factor in, okay, I'm learning posing now. Like that, even if your goal is just to compete, I would like, and not even win, I would say 6 weeks is too tight. You're just gonna stress yourself out. It's just too much to layer on at that point. So I love that you can do it, but you're there for
yeah.
the people that are that close. But I think it's good to get people in earlier if they
Yeah, no,
can.
I would not offer anybody else to do that. Do not wait 4 weeks or that was like just a miracle. And she's
Yes.
but yeah, no, just from the standpoint of even just stress, because I think you want to look your best. You don't want to be worried about being perfect and remembering everything because you're not going to remember everything, especially your first time, and that's okay. You're going to look great and you're going to have fun doing it, and I just know it. So just, I would say, honestly, if they did the 20-week and they wanted to contact me that same month that they're starting prep, great. If someone is finishing their show and they're like, these are things I noticed in my season and I want to improve on, great. Even if they don't have a show planned, I think there's no specific timeline. Just don't wait for you to feel leaner. Don't wait for you to feel like you're killing.
Yeah.
So just do it. Take the load off.
That's a good thing to address because I do think that's a barrier for a lot of people. Guys, so keep the questions coming in, please. We're going to wrap up soon. So, Shelby, thank you for asking. Can you share some of your most recommended mobility exercises to help with posing?
Yeah. I guess my question would be which pose and which division. But I would say some of my favorite mobility ones, or I guess Shelby, do you want to type in which one you are? Just so I can maybe give you a specific thing. Let's see. I'll give her a sec. Bikini. Okay, cool. Um, so I would say my favorite mobility ones, I think a lot of people talk about front pose and back pose because those are two big ones, right? The most common complaints I hear is not being able to rotate enough in the front pose or not being able to arch their back enough in the back pose. It's oftentimes a lot more deep than that for people because sometimes it can be another joint causing the immobility. But I will say, let's say if we're doing back pose, I actually did a video on my Instagram of it, but I like doing, you're on your hands and knees and you're doing a segmental cow. I guess there's like the angry cat and there's the cow. The reason why I say segmental is because that improves motor control. Oh, perfect. I'm so glad. She's like, those are exactly them. Um, so motor control, as opposed to a lot of people when they do the cat cow, they kind of hinge at one specific point, and that doesn't help. But if they purposefully go one bone at a time, and then on while they're here in that cow, I'll tell them to kind of rock back if they can while maintaining that pelvic position. That way too, say if your back post stiffness is actually because of a hip impingement issue, when your pelvis tilts forward, you arch your back, you have to realize that your hip also has to be okay in the socket with being in that flex position. So some people,
Yeah.
it's actually a hip impingement, like intolerance, and that's why their body doesn't want to go. But this hands and knees arching and rocking, that helps to improve mobility in your hips, your pelvis, and your low back. And then depending on what you feel, I might incorporate things like one of those thick mobilizing bands if it is a hip specific issue. But that's a good starting place for the back pose. And then for the front pose, for the rotation, I would say one of my easy favorites is just some open books, like I mentioned earlier to Chelsea, where you're unsupported. That's just a good starting point to see, is it truly a mobility thing? Because if you are totally on your side and you're keeping your hips laser beamed forward and that top hip is on the ground, or that, excuse me, that top leg while you're reaching back, if you're like, I don't feel any stretch at all, then it might not actually be a joint mobility issue with your upper half. It might be how your muscles are performing. So that's a good place to start too.
Gosh, that was such a good answer.
Thank
That's
you.
so great. I absolutely love this, and I will for sure be like reaching out to you personally because I think it's I myself and others, I see so many people get stuck on something and then just try to like force their way through it because there's probably something else going on. So I love hearing what you're contributing to help people because I mean it can be such a uphill battle if you don't know what you don't know. Is
Totally.
there anything else, Shannon, that you'd like to add in regards to the posing prehab aspect before we hit you with some hot seat questions?
Ooh, anything else that I want to mention about it? Honestly, no, I think we covered it as far as my intent and how I can help. So I think just contact me, even if someone isn't sure if they're wanting to do posing prehab. I don't just do the packaging. The packaging I think is the best deal. But for people that maybe they're like, I just want to drop in every now and then, habits wise, do I love it? No. But will I meet someone where they're at? Yes. So even if you're not sure, just contact me anyways, and we can chat about where you're at and what makes the most sense, and we'll figure it out together.
That's fantastic. I absolutely love that. Well, guys, well, feel free to drop any other questions you have in the chat, and we can always circle back to those. But Shannon, before we go, I've got a little past, present, and future question lineup for you. Are you ready?
Oh boy, let's do it.
What is one piece of advice you've received that has stuck with you?
Oh, my husband's advice. Are you ready? It's a good one.
Yes.
Okay. So I said this on the podcast with him. So my OG listeners will remember it, but it's just so good. So he has three rules, and it's look good, don't get lost, and when you get lost, look good. Meaning, seriously. So like look good, meaning like, obviously you take care of yourself, show up, present yourself well, treat people nicely, just look good. Don't get lost, meaning don't get spun up, don't get freaked out. Things are going to go sideways, things are going to go wrong. Don't freak out, don't spin up. Or I should say, don't get lost, don't do that. But when you do get lost, look good. So when things go wrong, just trust that it's all going to work out. Breathe, take a step back, maybe leave from the problem for a moment. But I think that that's just such a good framework in life, whether that's, starting a new job, maybe you're in the middle of prep, maybe you're nervous about show day, that can be applied literally anywhere.
Fantastic guiding principles. I agree.
Thank you.
Okay, I love that. Yes. If you could teach a class on one thing not at all related to your professional experience or expertise, what would you teach on?
Ooh, teach a class, meaning I already have the skill. Ooh, I would say, but it can't do anything with bodybuilding, can't do anything with PT, and can't do anything with dance.
I know dance is like the gray area. I would love to challenge you to say none of those three. Go for a wild card.
So I'm not gonna lie. There was one point where I was like, I live in Arizona. Scottsdale is a very common bachelorette destination. And for my sister's bachelorette in Austin, we had a twerk instructor come.
Oh
And I
my
was like, I could teach that. Like maybe I'll do a little weekend side hustle and I'll just go around and
If we ever do a meetup, can I get you to teach a twerk lesson in addition to posing?
perfect.
That's a fantastic skill. You never know when you're going to need it. All right, last one. What are your predictions for where the bodybuilding industry will be in the next 5 years?
Ooh, that's so hard to predict. I mean, I'm a natural athlete, and I think for me it has always been my goal to, I shouldn't say always, my goal has developed into like being more and more in the sport, right? So first it was stepping on stage, then it was all right, I would love to win an overall, and then it was like, oh, I want to place top five at natural nationals. Now it's I want to get my pro card, and now there's this beautiful, expansion of opportunity in the world of natural athletes. And to be honest, I was getting to a point where I was like, I don't know if I'll ever make it to the Olympia. I don't know because I look and I see everyone and it's like, whoa, they're all phenomenal. And I don't know. So like I would love to make it to Naturals Olympia one day, but I think within the next 5 years, it's just going to look so different. And honestly, I think that the numbers are going to
Yeah.
be there. Just the fact that there's another division too, I think is amazing. I love it. I predict, yeah, it's going to be bigger and better than ever. I hope that there's even more resources for health and wellness because I really don't think that was another reason why I was passionate about bringing my expertise into the sport. And I don't mean any disrespect on qualified trainers that have also done, their own research and education, because some people really love self-improvement and they like to understand biomechanics. But there aren't a whole it's not as normal, I think, for people to have all the same resources in the field. So I think, and I hope that the industry will look not only bigger, not only more opportunity, but I'm hoping, people like Celeste, that there's great relationships with food. I'm hoping that posing prehab is a well-known set standard, and people just feel like they are the best equipped for this sport to maybe when they do hang up the heels, that they walk away a better person.
Yes, I couldn't agree with all of that. Where the industry is going, and I'm just going to call it in terms of quality standards, for this arena that is so odd and that it's can just be so all over the place. So I love hearing that. I agree with you completely, and thank you for sharing for your goals as well, because the natural Olympia and just the expansion of everything natural, it leads to so much opportunity, and it will also lead to so much more competition because of the influx with that opportunity, which is really exciting.
Absolutely. Yeah, I'm so excited to be a part of it. It's gonna go by quick, which is crazy. In 5 years, we'll be here before we know it. So nuts.
Yeah. We'll circle back. Well, thank you so much. I really appreciate your time, Shannon. This information has been amazing, and we want to make sure that the members know where to connect with you. Can you tell us where they can find you?
Absolutely. And thank you so much for having me. I was so excited. I was telling
My
everybody
pleasure.
backstage about the live event today. I was like, yeah, I'm so excited because all the dancers were like, so excited to start prep and everything when you go back. I'm like, yeah. So for Instagram, you can find me at all of these shenanigans. Long story, I will soon be Doctor in Bikini across all platforms, but for now, I'm keeping it that because it's just kind of my whole life. It's not just bodybuilding,
Yeah.
Doctor in Bikini on Instagram. So it is all of the and then Shannon, ShannonIGANS. Otherwise, everything else is Doctor in Bikini. The podcast is Doctor in Bikini. Feel free to follow me across all platforms. And if you look in my bio on Instagram, it does bring you to my link tree where you can find everything, as well as the posing prehab applications.
Fantastic. And we'll make sure that we have all of this in the show notes, so that you guys can connect with Shannon and get more of her amazing expertise. Thank you, Shannon. This has been wonderful, and I really appreciate it.
Thank you. Thank you, everyone, for hanging with me. I appreciate it. And we'll talk later.
All right. Have a great night, everybody.
You too. Bye.